Hi, I'm Dr. Angela Valle. I'm one of the OBGYNs on staff at Los Robles Hospital. I'm going to be speaking about signs of labor and recommendations for when you should consider heading to the hospital. It's important to note that a lot of these recommendations are really for women who have reached full term. So if you are less than 37 weeks and experience some of the symptoms and signs we're going to be discussing today, you should really reach out to your primary OBGYN or midwife and discuss them further for further recommendations. For the majority of women, labor is going to occur with the onset of regular contractions that occur with increasing frequency and increasing intensity. The majority of women will experience contractions as a tightening or firming of the abdomen that gradually has an onset to its peak intensity and then gradually releases to minimal to no discomfort. However, some women will experience the majority of their labor pains in their lower back, and this is normal as well. For women anticipating their first birth, we recommend waiting until the contractions are about 5 minutes apart and that has been persistent for about 1 hour. However, if you are pregnant with your second, third, fourth baby, and you have a history of fast labors, you may want to consider heading to the hospital sooner. For about 10% of women, they will experience their first sign of labor as their water breaking, and this can occur even in the absence of any significant contractions. If this occurs, we recommend heading to the hospital as soon as possible. The risk of getting an infection in your uterus does increase as the length of time increases from when your water breaks. A lot of women experience other signs of impending labor or changes in their body, but these are not necessarily reasons you need to head to the hospital. For instance, a lot of women will experience losing a mucus plug. This is mucus that was in the cervical canal, and as your cervix softens and prepares for labor, many people will lose this mucus and notice it. However, this is extremely normal. This can occur days to weeks prior to labor and is not a reason to head to the hospital. It's also okay if you notice a little bit of blood-tinged mucus in the weeks prior to birth. That is also normal. However, any significant bleeding should be discussed with your provider. While these guidelines are useful for many patients, it's important to remember that labor is different for everyone. If you're uncertain about what to do, or you experience signs and symptoms that are not discussed in this video, we definitely recommend that you reach out to your primary OBGYN or midwife. We are always here to assist you and answer your questions. We know this can be a confusing experience, especially if it's your first, and we're here to support you in any way.